Hello, everyone. My name's Daryl Gordon, and I'm Vice President of Marketing at MediKeeper. And thank you for joining us today. Just a couple of quick, boring formalities before we begin, because I know you're more excited to hear from Dr. Amell than you are from me. The session is being recorded and it will be available on our website afterwards. There are 30 other sessions that you can go back and have a look at on demand. If you have a question today, please use the chat functionality. You'll find that right at the bottom of your screen. And finally, we are scheduled to run 25 minutes for the session. Today's topic is Wellness Trends 2025. Since 2017, MediKeeper has issued a yearly trend that helps organizations better plan and support their members to be engaged in a positive culture. To conduct today's session is Dr. Tyler Amell, the Chief Health and Strategy Officer at MediKeeper. Tyler, we're excited to hear the session for today.
Oh, great. Thank you, Daryl. I appreciate that introduction. And good morning, everyone. We really appreciate you taking time out of your busy schedules to join us here today to talk about trends and to share some thoughts and insight. This is based upon interactions with employers, with consultants, with other thought leaders in the space, and anybody who's got something to say about where things have been recently and where they may be going here in the near term. So as Daryl mentioned, I'm the Chief Health and Strategy Officer at MediKeeper. So from a complete affiliation and disclosure perspective, I am also on faculty and the registrar at Pacific Coast University for Workplace Health Sciences, which is a university solely dedicated to workplace health, very unique school. I also sit on the WELCOA Advisory Council, which is run by the folks at the International Foundation of Employee Benefit Plans. You may have heard we're going through a bit of a name change since we merged the National Wellness Institute in with WELCOA. And so that should be rebranded here in the near term to the Wellness Alliance. And I also sit on the executive board of the Work Wellness Institute, which is a similar organization, slightly different mandate. You'll see my LinkedIn handle is at the bottom of the screen. Feel free to reach out to me. I'm very active. I post a lot of content, almost all of it related to applied health research in workplace settings. And so post sometimes a couple times a week on what's happening from an evidence-informed perspective to use that to guide and inform practice, as well as a little bit more higher level overviews from a systematic review or meta-analysis. And sometimes it's research that I've conducted, and other times it's research that is posted in the broader literature base. As well, my email address is up there. Feel free to reach out via email as well. Daryl and I would love to hear from you about what you thought about today's webinar, as well as other ones. We try to do these about once a month or so. And so, we usually do 10 or so a year. And if you've got ideas or questions that you want us to do a little bit more of a deep dive, please don't hesitate to reach out. In this part of the webinar, we usually talk about some of my recent conference presentations as well as what's coming up here in the near term. I was fortunate enough to be invited to give a keynote address in Sydney, Australia, last November, which is only what six weeks or so, or 8 weeks or so ago, but it seems like a lifetime ago. This session was focused on integrated workplace health and looking at mental health as a common thread across the board. So, very interesting presentation there, highly engaged group in Australia. Then I give a talk in San Antonio at the end of November for the IFEBP on how to prepare for a healthy retirement. This was a deep dive session. This was a couple hours on the evidence and research supporting investments in your own health now in your pre-retirement years, whether or not you had 30 years, 20 years, 10 years, or retiring just around the corner. And the impetus behind this one is a lot of people spend time focusing on a retirement from a financial perspective, savings, contributing to 401ks and those sort of things just to make sure they'll have enough money to support their lifestyle. But they don't necessarily spend as much time thinking about what their health status is going to be at that point in time, because the health span is a little bit different than lifespan. And so, talked a lot about the research evidence to support a good quality, healthy lifestyle. Next up is actually next week, conference in Clearwater, Florida. This is the Health Benefits Conference and Expo. I'll be giving the opening keynote address, focusing in on return on investment and value on investment of wellness programs, which is always an interesting conversation. Where I'll be covering the latest research and thoughts on this aspect of our employer-based investments in workplace health. Next up is Health Innovations Conference in Puerto Rico. That's in February. I'll be speaking on innovative healthcare access, so leveraging global options, including some interesting payment strategies and plans that people, employees, or health plans can actually leverage from a financing perspective. So there's some neat stuff that we've done with Mastercard and a few other things there. And then finally, in terms of what's planning, the immediate planning is the 35th Annual Art and Science of Health Promotion Conference. So this is coming up in Scottsdale. This is in early April, first week in April. And I'll be speaking on integrated health strategies for enhancing employee well-being and reducing work disability. So trying to tie a lot of the threads around integrated solutions for employers in this sense. So if these conferences aren't on your agenda, they probably should be. These are great events, particularly the Health Benefits Conference next week and the Art and Science. Definitely should be considering attending. The WellCoA Summit, so the Wellness Alliance Summit, that's going to be in August in Austin. So looking forward to seeing folks there as we sort of launch the Wellness Alliance and that integrated solution. But that's not what we're here to talk about today. We're here to talk about trends. And so if we think back to what we did in 2024, we can take a look back and see how well we predicted things. Well, we started off 2024's session with a little bit of a thought-provoking statement, and that is engagement doesn't matter. The idea here being is that we delineated from employee engagement, which is usually what folks in HR are speaking about, versus participation, which is what folks in workplace well-being and wellness tend to focus in on. And the argument that I made in this white paper is something you definitely go back to and take a peek at was, when we're looking at participation measures such as this, it's participation of the right people, those most at risk for chronic disease. And so intervening and supporting those people, obviously has a greater return on investment. And it's not just supplementing folks who have already embarked on a health improvement journey and are more in a maintenance mode versus those truly at risk who are historically harder to reach. And so that was the idea behind that thought-provoking statement. Next up was this concept of employee burnout is not going away anytime soon, and judging by where it sits on our 2024 our 2024 and our 2025, this is bang on. We're not seeing this abate to any significant degree. In fact, things are probably getting worse, and I'll talk about that in a few minutes to give some thoughts and some ideas on that. Next up was artificial intelligence will have an even greater impact than it did in 2023, which definitely turned out to be quite true. Keep in mind that large language models and generative AI, particularly ChatGPT, was released by OpenAI at the end of 2022. So 2023 was the first full year that tool was available for employers and people to consider using in the workplace. And so in 2024, it definitely had an even greater impact than 2020. Three. But as we go into this year's talk, it shifted a little bit, and I'll explain what I mean by that in a few moments. We also talked about the notion that remote and hybrid work will be coveted by employees. Most certainly, it is definitely something that should be used as an attraction, recruitment, and retention tool to help meet people where they're at. And this shows up again in a slightly different format in the 2025 trends report. Next up is the 4-day work week. Now, I had published an article in one of the benefit magazines on the research to support organizations looking into this, and it is quite compelling from a health and productivity perspective, as well as just a pure productivity perspective. It's definitely time to consider this, knowing that there is an increase in productivity while we're able to support people with this approach. approach. And there's even more research that was released in 2024 that backs this up. So again, if this isn't on the radar, it probably should be. But again, this is only applicable to certain types of work environments. It doesn't work for transportation, for healthcare, manufacturing, those sort of things, unless you're on the knowledge side. And so obviously the type of work carried out needs to be included in that. So based upon this and the conversations that I mentioned before, we sort of started thinking about, well, what's 2025 going to look like? And so I came up with a list here. First and foremost on the list is something that I received a lot of feedback on in the past year or so, and that is this fact that employee healthcare costs continuing to rise, more impactful of employers that are self-insured than those who are fully insured or self-insured or ASO, administrative services only, versus those who are fully insured. But in fully insured models, you're still getting those costs passed on from the insurance carrier to the employers in this sense. So this is something that we've seen trending over the past couple of years, particularly when we look at data from 2023. We saw a 6.5% increase. 2024 about a 6.9% increase. Again, so that's compounded now. Now we're well over 13%. 2025, the consensus is that we're probably sitting at around a 7.7% increase, based upon some work from Willis Towers Watson. But they aren't the only folks looking at this. There's a whole bunch of other folks looking at it. And what we're seeing here is that the range is 7 to 9 and probably even closer to 10, depending upon the models and the estimates here. So this is in line with what we've seen on the work disability, so short-term disability, long-term disability, insurance, as well as directly funded plans associated with that. I haven't met very many employers who haven't seen a double-digit increase in those costs. So now we're seeing the healthcare costs, including the pharmacy benefit spend, drive that up. So these numbers are not going in the right direction. And if you're self-funded, this is sitting on the balance sheet. So this is quite problematic for a lot of employers out there who are looking for innovative and creative ways to help mitigate these costs. A lot of these costs are driven by chronic conditions, chronic disease, which of course is in permit and review for what we actually do from a health and well-being perspective on how we help mitigate risk and help people control existing conditions as well as prevent. We know an ounce of prevention is worth a pound of cure, but it is quite difficult to get folks to embark on that health improvement journey and prevent a lot of these conditions from recurring. It needs to have a very comprehensive strategy in place. Now, next up on the list for 2025 is stress, anxiety, burnout, and depression. Risk remains high. We have not seen any significant reductions in these sort of risks going forward. If anything, it's probably gotten worse. When we look at things at the macro level, we've got a rise in dictatorships and authoritarian governments, and folks looking to influence other countries. There's threat of war in Europe and Asia. And then there's inflationary pressures. We see this at home when we go grocery shopping, pay rent, mortgages, and these sort of things. And for folks at risk, this is piling on in terms of risk to mental health. And so, this is something that's not going away anytime soon. We're still seeing a big gap between inflation and wages. Wages have not kept pace with inflation. And so that's leading to a lot of issues. And when people bring up things like an investment in financial health and well-being, well, no amount of budgetary planning is going to help people when they can't make ends meet from that perspective. In fact, it's when you interview workers, they're quite insulted by saying, "Oh, all you need to do is budget better." Well, that's not necessarily the case when there's such a discrepancy between cost of living increases and the gap between wages. And so we don't really see this changing anytime soon. So employers would be wisely advised to continue to support and identify, break down the stigmas around mental health, and best support people and institute control and prevention measures. Absolutely critical to success going forward. Um, and then when we actually look at anxious data, we can see, and these data are from the American Psychiatric Association, we're looking at about 30% of the population, the US adult population in 2022, increased to 37% in 2023, 43% in 2024, and we're probably going to be sitting around 50% of the population by the time 2025 has come to an end. So if you don't think it's impacting workers in your cohort, it most certainly is. And then this is something that really should be on your should be on your radar. Now, next up, I took a little bit of a different approach when I looked at this notion of flexibility. We see this a lot from employee health and benefit strategies that are more aligned with meeting people where they're at and being leveraged as a true attraction, recruitment, and retention tool. And so this is where things like remote and hybrid work tend to come in because we're starting to see some pressure, not based upon research or evidence. We see increase in productivity, increase in satisfaction, increased in engagement when people are working remotely or from a hybrid position. I myself, I follow a hybrid model. I spend about 20% of my time in the office, which is where I like to be. Some organizations out there are being ill-advised that they need to cut this for culture or whatever reason, probably real estate, and it doesn't sit well with a lot of employees. So that will lead to higher turnover because organizations who aren't offering what employees are looking for, they're going to go elsewhere. And if you want to attract and retain best quality people, then offering up this as a suitable alternative, more so on the hybrid side, is definitely something that absolutely should be on your radar maps. Next up is the actual health benefit plan structure. And I bring this up particularly through the lens of looking at GLP-1 agonists. So this is semaglutide or Ozempic or liraglutide or tirzepatide. These sort of drugs are quite beneficial for not only treating type 2 diabetes and helping people be less impacted by overweight and obesity, but there's a whole host of other benefits that go along with that. Reduction in fatty liver, so steatosis decreases, cardiometabolic health increases. There's so many benefits to these types of drugs. So we're seeing, for the first time in a long time, an actual improvement in the amount of obesity and overweight that we see in the U.S. populations, particularly in the U.S. Southeast, which coincidentally were also heavily impacted by COVID mortality. So when you look at the number of people who passed away, when you had a higher number of risk factors, primarily overweight and obesity, and a few other things, the risk of more mortality increased, and so a lot of people passed away, unfortunately, during the pandemic. That's skewing the numbers a little bit, but you also have greater adoption of these types of drugs there. I put it on this list because this is something that a lot of folks should be looking at these days. In fact, there was a study that was done in Europe and published a couple of months ago where they actually looked at, the cost of, full state-sponsored GLP-1 medications being offered to the population. They would actually save money by fully funding these solutions for the population when you look at all the other causes of morbidity and mortality at a national level. Now, keep in mind in the U.S., the situation is a little bit different because the healthcare costs in the U.S. are significantly higher than anywhere else in the world, and we don't necessarily get any of the health benefit outcomes from that. From an outcome perspective, the outcomes are horrible, but the cost is higher than anywhere else. If we look at Canada, for example, the cost of GLP-1s are about 25% of what they are in the U.S. So when you factor in currency, it's actually even higher than that. So this is something that right-minded employers should very much be focused on. Another one is women's health, and this is something that can be seen as a true differentiator when people are considering which employers to join. It's been a long time coming. It's well overdue, but smart employers are thinking about these sort of things and really enhancing the type of benefit and the depth of benefits that are available here, which is something that is quite appreciated by folks who can benefit from this type of benefit. That's too many uses of the word benefit, I know. Next up is artificial intelligence at work. And, when we think about this, given the fact that we have more large language models, more of that generative AI, that was started by the folks at OpenAI with ChatGPT, Microsoft has Copilot, Google has Gemini. There's a lot more tools in the toolbox there. And knowing how to intelligently apply and use these tools in the toolbox is quite beneficial for organizations, particularly from the health and productivity perspective. Some colleagues and I actually have a book that's currently in press on using AI. My chapters were focused in on health and work disability and employee well-being, and how we can use these types of models to improve the efficiency and effectiveness of our work in this place, knowing full well that this is foundational work. It's quite beneficial, but you also have to use your brain, because the models are not necessarily generating the best quality outputs or recommendations. And we see that again in a broader sense too, with medication recommendations or medication information, that of course employees rely on their employers for healthcare coverage in many instances. Well, some of the models that are providing guidance to employees on drug and drug interactions and this sort of information actually produces the wrong information. And so the research in this has been quite clear that we shouldn't be relying on AI to sort of dictate that whatsoever. So again, we put these in this flexibility approach because this is quite a different strategy than we have in the past, and looking at things through this lens are quite impactful when it comes to meeting people where they're at, and then supporting folks who want to embark on that health improvement journey, either through the services or financial means from the benefit perspective on the pharmacy side, on the health side, and everything related to that. Now, finally on the list is this notion of worker health and safety protections being reduced. And of course, I use this in the broadest sense. When we have a change in government like we're experiencing right now, this tends to not necessarily work in the best interest of employees out there. And so we'll probably see some of these protections being rolled back, which is not good from a safety perspective or regulatory perspective, and definitely not from a health perspective with regards to how we can best support and promote and protect the health of people from that perspective. So I flagged this one knowing that there's probably going to be some rollbacks here, which are going to impact the health of people in the workplace, which does have a direct implication for how we protect and promote the health of workers in the workplace. So with that being said, that's where our thinking is for 2025. Absolutely would love to hear your feedback and thoughts. We really appreciate your time and attention today. And I'll turn it over to Daryl to see if we have any questions that we can answer now, or we can answer at a later point in time.
Yeah, thank you, Tyler. That was always a great, valuable insight. I'm always excited to read your trends for the year. But we have a couple of questions, but I think they're more specific to individuals. So if you don't mind, we're going to follow up with those ones directly. I want to thank everyone for joining us today. Thank you, Dr. Amell, for your time putting together. As a reminder, you'll find 30 prior webinars available on the MediKeeper website. If you have any interest in seeing them, you'll find them in the on-demand section. Thank you for joining us today, and have a great day.
Thank you, everyone. Take care. Make healthy choices.